So good afternoon, everyone. I'm Dr. Sandra McDonald, as I indicated earlier, and thank you for joining us this afternoon for our first beneficiary educational session. Welcome to all of you, and we appreciate you taking the time to share this afternoon with us. Like I indicated earlier, I'm Dr. Sandra McDonald, and I'll be facilitating the session this afternoon along with my colleagues, Mrs. Gabrielle Bastia, our provider, network and strategy manager, Mrs. Tanisha Pinder, benefits and enrollment supervisor, and Mrs. Chandra Sawyer, our health and wellness specialist. And you'll be hearing from them later on in this session today. So this afternoon session, we'll be discussing several topics around NHI, giving you an understanding of who we are and focusing on some of the things we're doing at the agency. So I wanted to give you a little bit of background of who we are as the National Health Insurance Authority. We're all about looking at our vision and our mission and making sure that Bahamians understand that we want to lead the way in providing accessible and affordable health care for all Bahamians. We know that you are deserving of the care, and so we want to make sure that we're changing the way we do business in country as it relates to healthcare. We're also focusing on transforming the healthcare system, making sure that the future well-being of the Bahamians are protected, and that we are making sure that the things we're doing reflect the fact that patients are actively involved in their care. And so we do that by demonstrating passion about our whole focus on healthcare and bringing about universal healthcare to all Bahamians. We want to be progressive and relentless in expanding access to quality healthcare throughout the nation, ensuring that we've got the right technology and that you understand the technology that we use and it's user-friendly. We also want to build partnerships with our beneficiaries and making sure we're dedicated to delivering affordable healthcare through building partnerships, not only with you as our beneficiaries, but also with the general public and major stakeholders in country like major employers. We also want to make sure that we're in the business of providing integrity and making sure that the services that we're providing to you we're ensuring transparency, and we're sincere about the services that we're providing, and we're accountable not only to you as our beneficiaries, but accountable to our partners and our physicians who are part of our network of providers. We also want to provide the services to you in a respectful manner and making sure that you as beneficiaries are being treated with respect and dignity. And so those are some of the things of an overview of who we are and what we're trying to accomplish in country from a healthcare perspective, and being the authority charged with the responsibility of leading the way in healthcare in the country. Next slide, please. Here are some of the things that we're focusing on as a part of NHI Wellness Program. We're dedicated to creating a platform where NHI beneficiaries and the public at large are encouraged and educated on adopting a daily healthy lifestyle by making sure they're incorporating regular exercise in their daily activities. They're practicing good eating habits and making sure that whatever they're eating is nutritional and not destroying them. I was just watching a video earlier last night that talked about how, Bahamians are the fattest people in the Caribbean. And we want to be able to turn that around by making sure we're sharing with you, our beneficiaries, how you can actually be eating healthy and how, food is like medicine and how we can turn that around. And then we also want to focus on emotional and mental health. And those things, the things like stress and financial stress, emotional stress, psychological stress, the things that impact us on an ongoing basis and impact the way our health from a system perspective, and making sure that we're making really good health choices. We want to make sure that every Bahamian understand the importance of maintaining a healthy lifestyle, and they're ultimately involved in the whole process of being responsible for their health. And so with that in mind, I'm now going to turn it over to my colleague. This is Gabrielle Bastian, who's going to talk to you a little bit about what it is that we're doing at the authority and what's going on, and how you, as part of the authority, what role do you play in this entire process of making this whole program successful? Gabrielle?
Thank you so much. Good evening, everyone. So I'm going to just help you understand where we're at now at the authority. We've made significant milestones since inception in 2017, and we've worked hard to execute and further deliver on our vision of advancing the path to universal healthcare. Our goal is to ensure that Bahamians and residents have access to quality healthcare services without any financial hardships or burden. So, as a part of this journey, significant investments were made in technology. In November 2019, the authority launched the electronic health record, which digitized paper medical records in each provider's office. As a beneficiary, you not only have access to a physician of your choice or your family physician, but as a patient, to access your patient portal via the electronic health record. And this allows you to book appointments, access your lab records and reports, review various educational materials sent to you by your provider. And an added benefit of this technology is the use of the built-in telehealth platform, where beneficiaries can access their providers by using technology to bridge the gap in the delivery of care, especially now in this environment of COVID-19, and of course, in instances where we have beneficiaries that reside in the Family Islands. So for example, telehealth allows physicians to activate a telehealth call via secured Wi-Fi connection with beneficiaries anywhere in the country. The technology or the telehealth module itself allows you to see your primary care physician from the comfort of your home or office. This care is enabled in real time. So again, our first point on this slide, digitally enabled care. Second is now our enrollment growth. NHI is the talk of the town. Enrollment growth and diverse demographics speaks to that. Over the last 5 years, NHI has experienced significant growth. Currently, there are more than 123,000 Bahamians and residents enrolled into the program. What a proud achievement and accomplishment for us. And this includes 5,700 plus Bahamians under the age of 5 and over 14,000 beneficiaries over the age of 65. I'm most proud to talk about our expansive provider network, being the provider manager. So currently the program is made up of 107 private physicians, over 63 facilities, and they extend across 6 islands, which include Abaco, Bimini, Exuma, Eleuthera, Grand Bahama, and of course, New Providence. And the NHIA is continuously looking for opportunities to expand our network of physicians through the Family Islands. And I'm happy to share with you today that we have over 10 new facilities in our pipeline. So that means I'm looking to onboard 10 facilities who have made application to the authority to serve you as the primary care provider. Our goal is to ensure that we have representation on each island. We've also partnered with 7 major labs, and that's a big one, and some of which include Bahamas Medical Lab, Bonaventure Medical Laboratory, Doctors Hospital Lab, Oak Tree Medical, Premier Clinical Lab, the Family Medicine Center in Eleuthera, St. Thomas Medical Lab in Abaco. And that network is also growing. So as we grow our network, as we add providers to our network, you will continue to be updated. Last on this slide is high patient satisfaction. So what does that mean? And really, it is our positive beneficiary satisfaction rates through surveys remain a priority for us. The NHIA program works by choice. So you, as a beneficiary, decide which provider you want to see and which facility you'd like to access for those services. This ensures that you have a choice in the delivery of your healthcare. In the last 5 years of delivering primary care services, we've also continued to experience high patient satisfaction time and time again. Here's a little tidbit for you. 96% of those persons surveyed and enrolled into the program stated that they are satisfied with the services that they receive from their primary care provider or family physician. So beyond ensuring that healthcare is accessible and affordable to you, it's also important to learn that as a beneficiary, what your experience is like. It's important for us to understand that you accessing care that's modern, affordable, and accessible is a success of NHI. The success of these initiatives that I've outlined earlier continues to confirm that we're definitely diligently working towards our journey of universal healthcare. Advance for me, please. So you've heard from me, and now I'm going to let you hear from my colleague, what you've really been here and waiting to hear from today, the benefits, a program overview of NHI. And you'll hear from Tanisha Pinder. She is our benefits and enrollment supervisor. So Tanisha Pinder is an administrator with more than 25 years experience. Her specialties include, but are not limited to, office management and customer relations. She currently serves as the benefit enrollment supervisor at NHI and is responsible for two major things: overseeing the daily operations of the benefits and enrollment department, and those individuals that help you from the customer service standpoint, process your application, provide you with general information regarding inquiries, all of that stuff on a daily basis. In addition to, she's assisting with the primary care providers who are registered with the authority, delivering care in accordance with the NHI plan and benefits. Ms. Pinder is always a joyful individual, and she's ecstatic about her role at the authority. And she's been instrumental in shaping and transforming healthcare in the Bahamas. So over to you, Ms. Pinder.
Good evening, everyone, and thank you so much, Mrs. Bastian, for that introduction. So this evening, I'm going to walk you through the benefits you can access today under the NHI plan. However, it is important to note that NHI is being rolled out in a phased approach. And yes, we are looking to add additional benefits as we continue to grow the plan. So I promise we will keep you up to date on every step of the way. Advance, please. So what is covered and what is not covered under the NHI plan? So today, under the NHI plan, beneficiaries can access a range of primary care services, which includes your general physician visits, your annual physicals, maternity care, periodic health assessments, the majority of laboratory tests, vaccines, immunizations, cancer screening, and we also offer a full panel of STD screenings, as well as chronic disease management. So let's talk about that a little more in detail. Can you advance, please? So for the expecting mothers, our maternity package covers the pregnancy test, prenatal doctor visits, your lab tests, screenings for genetic characteristics. And for our infants, our little darlings, infants are also eligible for pediatric primary care visits. Upon enrollment, they can benefit from the following: their lab tests, growth measurements, immunizations, their regular checkups, as well as their general sick visits. Advance for me, please. Our school-age kids are all entitled to their annual school physical, growth measurements, developmental screenings, asthma care, and all of their required immunizations. For the adults, you are entitled to annual checkups, your general sick visits, your NCD screenings, all of the required vaccinations, annual prostate tests, for the men over the age of 40, the pap smear for cancer screening, full panel of STD screenings, as well as counseling on how to reduce the risk of these diseases, such as diabetes being one of them. Next slide for me, please. So let's talk about what is not covered under NHI. So currently under the program, we do not cover overseas care, dental and vision, prescription or medications, emergency care such as heart attack or broken bones, inpatient hospital care, surgeries, chemotherapy and radiation, rehabilitative care, and also we do not cover deliveries of babies. We also do not cover mammograms, ultrasounds, ECGs, X-ray, colonoscopies, or MRIs and CT scans as well. Next slide for me, please. So now let's talk about who can enroll into the NHI program. To be eligible to enroll or to register under NHI, you must be a legal resident of the Bahamas and have an NIB smart card. There are no age restrictions to who can enroll. And once enrolled into the program, you will select one provider from our network as your primary care physician. You will be covered for unlimited number of primary care visits at no cost at the point of care. There are no copays or deductibles. And you can change your primary care provider for any reason at any time. Next slide for me, please. So now I want to share with you some tips on when planning a doctor's visit. So the key is preventative care. So your primary care provider mission is to help you stay healthy. They're there for you, whether it's an occasional illness or support and guidance in managing a chronic condition. So here are some tips. Find out if your doctor accepts walk-in or appointments by calling ahead before visiting. And this is very important, especially for new persons enroll into the program. It's very important that you always call your physician. Once you receive your service start date or your service coverage date, it's important that you call your provider's office and make that first appointment or to confirm whether they do accept walk-ins. But in this COVID environment, most of our providers would prefer appointments only. Next, share any symptoms you may have via telephone. So when you do call to make that appointment, it's important to share with the administrator or the receptionist if there are any symptoms that you're experiencing at that time, so that they can know how best to serve you, whether they can invite you for a face-to-face meeting at the office or, as Ms. Bastian spoke about, our telehealth visits. Next, make a list of your concerns. Any concerns, anything that you would like to discuss with your doctor, it's important that you, prior to that first appointment or that appointment with your doctor, write the list out, because sometimes once you're present with that physician, you may forget. So we encourage you to make sure that you write all of your questions or concerns so that your doctor can address them. Next, be open about your medical history, inclusive of any prescription or non-prescription medications that you are taking. And this is very important as well to your health, right? To be honest and to let your doctor know what are some of the things that you've been experiencing or things that you've experienced in the past. What are some of the medications that you're on now, whether they be prescribed or if they're non-prescription medication. Tell your doctor about any allergies that you may have. That's also important whenever they're prescribing medication. It's important for your doctor to be aware of any allergies that you have experienced. Also, ask about any medication that is prescribed to you. Ask, why is it being prescribed? What are the possible side effects? And how should I take those things? These are very important questions to ask your doctors. I hope that I've provided you with some tips that you can use. These are very important whenever you're planning a visit with your provider. Next slide for me, please. So how to enroll? So there are 4 easy ways to enroll. At this time, you can enroll online by visiting us at www.nhibahamas.gov.bs. just click on the Enroll Now button and follow the instructions, or simply send us an email at info@nhibahamas.gov.bs. We respond within 24 hours to any of your emails. Just make sure that you please insert all of the pertinent information, such as your full name, your NIB number, and your contact information. Or simply just give us a call on 396-8500, where one of our customer service reps will be happy to assist you. Or we would love for you to just visit us at our office on East Street and Purpose Way. We're open from Monday to Friday, 9 until 5. So please feel free to visit us, where we offer curbside service at this time. Next slide for me, please. So now, please be sure to type. I'll now open the floor to any questions that you may have at this time. If you've typed those in the chat, a member from our team will be happy to read those off for me. So Ms. Sawyer, do we have any questions?
Hi, good afternoon, everyone. Good afternoon, Ms. Pinder. Yes, we have received the question. The question is, how often can I see my NHI doctor?
Oh, that's an excellent question. So you are covered for unlimited number of visits with your primary care doctor. So you have access to your doctor as long as you just call, make your appointment. You actually have unlimited visits with your primary care doctor.
Another question that has come to us in the chat. Is there any costs associated with enrollment in the program?
There is no cost for beneficiary enrollment in the program, and there is no cost at the point of service, as I said. So enrollment is completely at no cost under the NHI program. It's free to enroll under the program. To enroll, you must be a legal resident of the Bahamas and have an NIB smart card.
Thank you, Ms. Pinder. Another question that is recurring. Can I sign up for more than one doctor?
So under the plan, you're only allowed to select one primary care provider to access your services. And the reason for this is our doctors are paid on a capitated model. And the reason we pay on a capitated model, because we want to make sure that our beneficiaries have easy access to their doctor and that we can offer you unlimited visits with your primary care provider.
Thank you for that. Can I enroll if I have private insurance?
Oh, that's a very good question. So currently, individuals who have private insurance can access the service under the NHI plan. So you can use the NHI. Most persons are now using the NHI plan for their primary care services, and they're using their private insurance for all those services that are not covered under the NHI plan. So that's more of the emergency services.
Thank you, Ms. Pinder. And what about, is there a particular time frame that I have to use the services?
Sorry, repeat your question, Chandra.
Do I have to use the services within a particular time?
So once your coverage begins, you can access your provider. You have access to your provider. You decide anytime after that date when you would like to access your services. However, we do encourage you to utilize the service by having your annual physicals. But you have access, you determine when you would like to access that provider. Once we provide you with that service start date or your coverage date, you can go ahead and proceed to make the first appointment with your provider. But there is no stipulation as far as when you can access the service. Once your service coverage begins, you decide when you'd like to access the service. But I do encourage you to have that annual physical done.
Yes, that's very important, Ms. Pinder. And does NHI cover specialty services?
So NHI does not cover specialty services at this time. You would need your private insurance coverage for those services, or you would have to cover the cost out of pocket. So those are some of the things that I discussed earlier, what is not covered under the program. And so persons with private insurance will have to use that, or it will become an out-of-pocket cost to the beneficiary.
Thank you, Ms. Pena. Your session this afternoon was very informative. And these were the questions that were provided to us.
I think that there is another, my apologies. The chat is moving quite quickly, as well as we're getting a number of direct messages as well. So there's a question here. How long is it after registering would you receive an NIB card? So a point of clarification here is that once you have an once you have an NIB smart card, you're eligible to register for NHI. And so NHI, not to be confused with the National Insurance Board, with the National Health Insurance Authority, you go directly to them to apply for your card. Now, we know that in this instance, they may not be issuing cards or renewing cards, but you will always have your standard unique identifier NIB number. You're able to apply to us at the National Health Insurance Authority using your NIB number if you do not have your card at this time. So I hope that that provides some clarity regarding the NIB cards. So again, you do not need an NHI card. You will present your NIB smart card or your number to your primary care provider when you go to access services so that they can verify your eligibility into the program. And this is another one. If my NIB card is expired, will it still be able to receive service? Yes. So the National Insurance Board had issued a notice, a memo to the general public a few weeks ago. And they have stated that you no longer need to renew your NIB smart card right now. In this instance, they are advising all agencies and entities and organizations to accept the existing smart cards as they are, though they may be expired. The numbers don't change. So your unique identifier will always follow you. So the number is still valid.
Ms. Bastian, I see there's a question in the chat concerning providers in Grand Bahama. Can you speak to that? If any of those 10 facilities that we're about to onboard, of any of them Grand Bahama?
Yes. So that's an excellent question. So we're constantly looking to enhance or expand our provider network. We do have a number of providers in the pipeline, about 10 of them, and we are looking at a few facilities in Grand Bahama. Let me just add, however, that NHI has quality standards and measures that are put in place that our providers would have to meet before they can be eligible for participating in the NHI Bahamas program. And some of those things are facility inspections, compliance documentation, as well as there is a contract between the NHIA and the physician. And so all of those things would have to align in order for that physician to be onboarded into our program. So quality is very important to us. I know that Dr. McDonald, our quality manager on the line, is smiling because our physicians are subject to quality standards and facility inspections. But to answer that question directly, we do have applications from at least 2 providers in Grand Bahama at this time.
Awesome.
I'm still looking through. Please pardon me. I'm just trying to scroll through the questions to make sure that we cover a variety for you all.
So, Mrs. Bastian, there's a question in the chat that addresses curbside registration in Grand Bahama. Just want to make everybody aware of the fact that currently we do not have an office in Grand Bahama, but we do have providers and facilities that are part of NHI. And so there is no curbside services for registration in Grand Bahama.
Yes, and they can still enroll by any one of our 4 means of registration. So If you take us back to that slide, please, so we could just leave that up, please, Chandra, just so that everybody can make note of that information. I also saw a note requesting where you can find our providers listing. So we're going to drop it in the chat as well, but here it is, where it says visit us online at www.nhibahamas.gov.bs. There's a wealth of information there about NHI. Not just select to registration, but it tells you about the program, future initiatives that we have, viewing our provider network listings, whether that's an actual family physician or a laboratory. There's also accessing your beneficiary portal where you can update your information or make changes to your account there as well. So the website is not just for enrollment, it's only a feature on the website, and it's intuitive and easy to navigate. There's a question here, when will emergency services be covered like heart attack or stroke? So thank you for that question, and I think that that's I'd say that that's a tricky one to answer. NHI is exploring various models and options of enhancing our suite of benefits as it is. To give you a timeline right now, I cannot say. What I will say is as we make advancements in the program, especially with the enhancements of our benefits package, we will let the public know. From time to time, on an annual basis, we conduct surveys as well to find out what are some of those services that our beneficiaries would like to see. And so we take that into consideration. Also from a quality and a wellness standpoint, we take a look at our health metrics to determine what are the next steps in terms of where we should go with the direction of the program. So we want everything and every decision that we make to be centered around our patients, and that being evidence-based. As Ms. Pinder mentioned, this is a phased approach, and as we roll out the various phases, we'll be sure to publish that information to the general public. I'd also want to make a note that there are some questions or comments relative to personal experiences, referencing your actual physician. I want to encourage you to reach out to us directly via email or telephone, so that we can put you in contact with a representative to look into your actual case for you to offer a bit of guided assistance. The information that we are offering right now is purely general, but due to the nature of your inquiry, it may be best to provide you with specific information. So feel free to contact us directly.
I see I have a question here concerning provider change. So yes, you are permitted to change your provider at any time. Please contact us at 396-8500, or you can shoot us an email or just visit our office, and we will just need your NIB number and the preferred physicians whom you would like to be assigned to. So you can change your provider at any time.
Ms. Pinder, there is a question addressing defining primary care and what is covered under primary care. Can you reiterate that, the answer to that question? I know you covered it before, but can you speak to that again, if you don't mind?
Go back to that slide. So currently under the NHI plan, all beneficiaries have a range of primary care services, and some of those include your general sick visits, your annual physical, maternity care, pediatric care, periodic health assessments, the majority of laboratory testing, vaccinations and immunizations, your cancer screenings, the STD panels, and chronic disease management. These are all covered under your primary care services under the NHI plan.
There is also a question that asks, can I use a doctor other than my primary care doctor?
So no, under the NHI plan, each beneficiary is allowed one primary care provider, To access all of your services, you must come through your primary care provider to access services under the NHI plan.
One of the things that I'd like to share with our beneficiaries is as an NHI beneficiary, the expectation is that you would go in and see your doctor at least once a year. And that's going to help you and as well as help us at the authority, because we don't want you to wait until you're sick before you go in to see your doctor. So if you're enrolled in a plan and you've not been to see your doctor over the last year, may I encourage all of you to please make an effort to go in and see your doctor and not wait until you're sick, because when you're sick, oftentimes it may be pretty late. So we want to make sure that we're focusing on preventative care rather than you waiting until something happens. Those persons who actually go to see their doctor on an ongoing basis or annually, usually if there's something going wrong, would typically catch the issue early. But if you wait until something is wrong with you before you go to the doctor, then it may lead to something that's more chronic. And so we encourage each of our beneficiaries to at least go and see your doctor at least once a year, get your checkups so that you can stay healthy. We want a healthy Bahamas. We want our population to be healthy, and you can help us with that by going to see your doctor once a year at least, at minimum. So please be mindful of that and share the word with your colleagues and friends and family members that the service is free and they should at least go in and get their history and physical at least annually or once a year.
Dr. McDonald, thank you for that. Just looking through the chat, another question came up as it relates to providers. If a physician is retiring, will another physician be assigned to the patient, or is it the responsibility of the patient to locate another?
So that's an excellent question. So not even in the sense of retirement. Sometimes what we have seen happen is that physicians may transition out of the program for varying reasons. The number one reason that we have encountered is that our general practice physicians move on to continue their educational development to specialize, let's say in family medicine, or in this case, if a physician is retiring. So no, we would reach out to our beneficiaries proactively to plan that and to help with the transition. You will not automatically be reassigned to another physician. Rather, in the introduction that we stated that this program is about choice. So our customer service representatives would reach out to our beneficiaries directly to inform them of the situation, whether or not the provider is going to leave the program, if they have a limited amount of time left into the program, and to help you get situated with a physician that's best suited for you. So, and just to talk to you a little bit about that process, because I'm getting a number of direct messaging, and I think I can tie them all together in this case. Some of the ways in which we can assist, we don't refer directly and tell you, oh, we feel that you should go to this physician. Rather, we help you make the choice. And so we would ask you questions. Is there a particular area that you would like that physician to be in? Do you have a preference in specialty? Do you prefer a male or a female? Things of that nature to help you choose which is most convenient for you. So in that instance, we'll reach out to you directly if there are any changes in the program and then walk you through the process of selecting or being reassigned to another physician. Can 14 and 16-year-olds register without a parent doing it? So that's also an excellent question. So physically, anyone can register if they have the ability to utilize a device that's connected to the internet. They can be enrolled. The caveat here is that these are minors and that their applications are tied to their parents' information. So their parents' information will be required for the completion of that application because they are minors. Oh, this is another excellent question. Oh, I'm so excited to see this. I'm assuming what happens to your medical records when your primary care doctor leaves, or should you leave, or should you move to another NHI physician? So here's what will happen. Remember, we talked about the electronic health record and we launched that in 2019. So what that means is that all of your information is stored on the cloud. So that eliminates the need of you having to go to your doctor to try and retrieve records. In some instances, records may be misplaced, physical records may be damaged. With the cloud storage and the use of the electronic health record system, or EHR as we call it for short, your information is digitally transferred. So let's use me as an example. I currently reside in New Providence and I relocate to Grand Bahama. When I go to Grand Bahama and I'm transferred to a physician there of my choice, I can request that my records follow me. So that means that there is continuity of care and that physician has access to my records. And Ms. Pinder spoke about any medication that I may be on, any known allergies, my past medical history. Essentially, my new physician has access to my information through the electronic health exchange by way of the electronic health record. Can you still request your file even though it's on the cloud? Yes. So you can request your information directly through the provider. So when we say it's in the cloud, it's not lost. It's just a means or a mechanism of added security. After signing up, how soon will you be approved and can you visit your doctor? That's another excellent question. So typically when you enroll into the NHI program, we do have an administrative date. All of our enrollees coverage begin at the 1st of every month, okay? So that means if you enroll by the 21st, follow me now, if you enroll by the 21st of any given month, your services come into play the 1st of the following month within that next couple of days. If you enroll on the 22nd or thereafter, then your coverage is deferred until the month after that. So today being March 31st, those individuals will not receive, if they enroll today, will not receive an April 1st date. They will receive a May 1st date of coverage.
Mrs. Bastian, would you mind addressing issues surrounding gynecological care, obstetrics and gynae? If a patient is seeing a primary care physician and wants to transition to obstetric physician, how does that process work?
Great. Thank you. That's a great question. So that process works as it would in any case in particular. If you are currently being seen by your primary care provider and there's a need for you to be seen by our obstetric provider, then the referral process is exactly the same. Just as your provider would make a note or a request for you to see that physician, they would either contact that physician directly or you're free to reach out to that physician directly. There's an internal mechanism in place which the physicians know how to coordinate for the transition or a referral of a beneficiary. So not just in the case of obstetrics, while that is quite popular, when it is discovered that a female is pregnant, there are instances where she is referred to our obstetrician. But in the case of being referred to any other provider within the program, the same applies.
Okay, excellent questions. Hopefully we've gotten all the questions in. I want to keep everybody mindful of the fact that if your question was not answered today, may I encourage you all to reach out to us by calling 396-8500, or sending us an email at info@NHIBahamas.gov.bs. I think it's in the chat, so you can actually get that information from the chat. Also, keep in mind that these educational sessions are designed with you in mind, and the goal is to make sure that we're addressing issues that concerns you. And going forward, we'll be doing these on a monthly basis, making sure we're addressing topics that are relevant to your issues and your concerns, and keeping you abreast of what's going on at the authority, promoting health and wellness throughout the Bahamas, and ensuring that our beneficiaries have the education and information necessary to make intelligent choices when it comes to their health care, and that they're participating in along with their doctors and being engaged in their health care. So it's all about you, our beneficiaries, to ensure that we're together building a more healthier Bahamas. So thank you so much for your opportunity to share with you, today. Are there any more questions that we didn't cover, or any other final comments from my colleagues, Mrs. Pinder or Mrs. Sawyer or Mrs. Bastian? Any final comments?
So just to add, Sandra, yes, we do. I just want to encourage our beneficiaries to, go and have that first annual physical. Like we said earlier, preventative care is really the key to a healthier Bahamas, and that is the ultimate goal of the NHI program. So we want to encourage the beneficiaries to go out and have their annual physicals. And, any questions, concerns, or comments, as Dr. McDonald has said, if we didn't get to answer those tonight, please feel free to reach out to us. You can give us a call on 396-8500, or shoot us an email on our info@NHIBahamas.gov.bs. We'll be happy to answer those questions for you.
Thank you, Mrs. Pinder. Mrs. Bastian, any final comments?
I just want to thank everyone for their attendance tonight in this session. It's truly been a great opportunity for us, this being the first beneficiary educational session that we have hosted. Certainly, I was quite engaged and proud of the questions that I've seen. Means that you're really engaged and interested in the NHI Bahamas program. And as you can see on the screen, here are our ways to contact us. Just want to put a plug in there that we are also on social media. So our social media handles: Facebook, Instagram, LinkedIn, and Twitter, NHI Bahamas. So feel free to reach out to us if you want to send us an inbox message through any of those means. That's fine as well. Or you can send us an email or call us up directly. We thank you for your time this evening.
Yes, thank you, everyone.
Thank you, everyone, for being such an engaged platform this afternoon, an engaged participant. We appreciate your questions, and like my colleagues shared, make sure that you reach out to us if we didn't answer your question tonight. I noticed that there are some comments around nutrition, and there will be more sessions coming around nutrition and how we can all work together to create a more healthy and wealthier Bahamas. So thank you for the gift of your time this afternoon and for being such an engaging audience. We look forward to seeing you next month when we do these sessions again. Make sure you spread the word, and for those persons who have not gone out and gotten your physical, let's make sure you get your physicals and encourage your family members to join the program and go out and get their physicals. Again, have a wonderful afternoon. Someone else is saying something. I apologize.
Just want to add also to persons, current beneficiaries on the call, to please also to reach, if you haven't been receiving any emails from the authority, that may be because we do not have updated information for you. So we're asking that you please reach out to us as well to confirm the information that we have on your profile. So that's your contact information, your cell number, home phone number, and also your email address. Please feel free to reach out to us at any time on any of those platforms that we provided.
Thank you, Mrs. Pinder. Again, what a wonderful experience this afternoon. We appreciate you all attending. Look forward to providing you with more exciting topics in the future. If there's a topic of interest that you'd like to see the authority cover in these sessions, make sure you let us know that by sending us an email like we indicated earlier. I think you have all of our contact information. And let's stay in touch. We want to make sure that we're engaging with you as our beneficiaries. We want to make sure that we're listening to you and hearing your concerns and addressing your concerns. We're here to serve you as the authority, and together we'll work towards building a more healthier and wealthier country. Chandra, is there any final comments from you? Mrs.
Yes,
Sawyer?
good evening, everyone. I just wanted to add, in addition to the beneficiary educational sessions, which we launched this evening, we have also provided our beneficiaries with an NHI Power Hour, which is a 1-hour exercise session, which takes place every third Thursday. We host this complimentary session, which is led by a certified fitness instructor right at our headquarters, and we're located on East Street and Purpose Way. And then we have also launched our wellness newsletter. And so again, as Ms. Pinder would have alluded, if you have not received information from us, especially electronically, please submit that information to us through any of our social media platforms so that you can be added to our mailing list, where this is an opportunity for you to receive tips on fitness, healthy recipes, and more. Thank you so much.
Awesome.
Excellent, excellent. All right, we look forward to seeing you at our Power Hour coming up for the month of April. Again, we'll be presenting another educational session, and the newsletter will be coming out soon. So thank you, Sandra, for sharing that information. Thank you, everyone, for the gift of your time this afternoon. We appreciate you attending, and please spread the word about the sessions, the educational sessions, and have a wonderful evening. Take care, everybody. God bless you. Bye-bye.